Hi, my name is Dr. Peter Chung. I'm a developmental behavioral pediatrician at UC Irvine, and I'm going to be presenting on Autism 101. What is autism? This short presentation is meant to be an introductory overview on autism for individuals, families, and care providers, especially targeted to those who are new to or unfamiliar with the diagnosis of autism spectrum disorder, or ASD. So, how many people are diagnosed with autism? Well, the numbers appear to be on the rise. In 2014, the Centers for Disease Control and Prevention, or CDC, showed that 1 in 59 children had a diagnosis of autism spectrum disorder in the United States. In 2020, the CDC showed that 1 in 54 children had a diagnosis of ASD in the United States. This represents a 10% increase. Part of the increase in overall prevalence could be due to a growing awareness among healthcare providers of the need for autism screening and treatment. Experts also see some contribution from greater inclusion of children from different racial and ethnic groups. In addition, we may be diagnosing children earlier with ASD than in the past. That's been a primary goal for many autism centers. For example, more children who were born in 2012 received an ASD diagnosis by 4 years of age compared to children born in 2008. Despite these factors, however, it does also seem that the number of children with ASD is increasing over time. The reasons for this are not known. What's held steady over time is a difference in gender. More boys than girls are diagnosed with ADSD at a ratio of roughly 4-to-1. Autism affects all ethnic and socioeconomic groups. While historically ASD was seen as a diagnosis more often in white children, the most recent data have shown that this gap seems to be narrowing. What is autism? Well, we'll be exploring this in several ways. Broadly, we can describe autism as a lifelong disorder that influences how people process information, engage socially with others, and communicate with others. More clinically, we can say that autism is a neurodevelopmental disorder based on a wide spectrum of behaviors that include social communication and interaction deficits and restricted or repetitive patterns of behavior, interest, and activities. What causes autism? If I could answer this question definitively, I'm sure I'd be in line for a Nobel Prize. What we know for sure is that there is a genetic predisposition in some families for the disorder. ASD has been associated with 100 different genes. Most scientists and researchers believe that it is a prenatally acquired disorder, meaning that it is acquired before the child is actually born. There is no research to support that vaccines, including those containing mercury, can cause autism. As a side note, I should also mention that neither mercury nor its related compound thimerosal is present in any of the common childhood vaccines administered today. There is also no research to show that parenting practices cause autism spectrum disorder. So as I often say to the parents of children who have autism, there's nothing that you did or didn't do that caused your child to have autism. It is most likely something that the child was born with, and the symptoms of ASD manifested over time. What's it like to be a child with a diagnosis of autism spectrum disorder? Let's watch this video to get a glimpse into their world.
We are all different, and that's wonderful. Some differences are easy to see. Height, hairstyle, gender, eye color, and so on. Other differences can't be seen. Our favorite foods, fears, or special skills. Interestingly, the way we see the world is also different. For instance, what do you see in this drawing? Most people see a duck, but some of you might have seen a rabbit. Whichever you saw, you are correct. This is just a trick drawing to show you that all brains work differently. The brain is your body's computer. It works differently for all of us and controls how you learn. That's why we are all good at different things. How you feel, which is why we all feel different emotions. And how you communicate. Sometimes the brain is connected in such a way it affects senses and how we perceive and read situations and interactions. This is known as autism. Many people have autism. So it's likely you already know someone who is autistic. And for this reason, it's useful to know a little bit about autism. The special wiring inside an autistic brain can sometimes make the person good at tasks we may find difficult, such as mathematics, drawing, or music. It can also do the opposite, and activities we find too easy are incredibly difficult to them, such as making friends. The senses constantly send information to your brain about your surroundings and other people. However, when a person's brain and its senses don't communicate well, the brain can become overwhelmed and confused, affecting how they see the world. Picture yourself walking down the street. This is how an autistic brain may experience the same walk. Scary, isn't it? Sadly, in many cases, the person can't say out loud how they feel. So even though there's chaos going on in their heads, they seem okay on the outside, unable to ask for help. We all develop behaviors to help us feel calm in uncomfortable situations. We may look away, hug ourselves, chew our fingernails, fidget, bite our lips, and so on. Equally, autistic people develop behaviors that help them cope with these intense moments. These actions may seem unusual, but they're just their way to feel calm. When they happen, it means they are having a hard time. The kind thing to do is not to give them an even harder time by getting cross, ignoring them, or mocking them. Remember, just because a PlayStation can't read an Xbox game, it doesn't mean it's broken. People with autism need friends who are willing to take the time to know them. With good communication and plenty of patience, everyone would be better off. People with autism are not ill or broken. They simply have a unique view of the world. And with a little support from their friends, they might just be able to share that view with us. Autism can make amazing things happen.
There are 3 levels of autism spectrum disorder. Each level dictates the amounts of support the child or individual will require to function independently. The level of severity may vary by context and fluctuate over time. The terms Asperger syndrome and pervasive developmental disorder not otherwise specified, or PDD-NOS, are no longer recognized by psychologists or medical providers. Instead, all levels of autism spectrum disorder are defined across a spectrum of level 1, 2, and 3 support. These severity levels can be further illustrated by more specific language. The severity of social communication difficulties and restricted, repetitive behaviors should be separately rated. Again, the manifestation of the disorder can vary greatly depending on the severity of the autism, developmental level, and chronological age. Hence, we use the term spectrum. Let's dive a little deeper into the specific symptoms of autism spectrum disorder. We use something called the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5. This reference provides us with a specific criteria used to make the diagnosis of ASD. There are 2 main categories of behavior that make up this diagnosis. The first set of behaviors have to do with social communication and interaction. Individuals with ASD must exhibit persistent difficulties in social communication and social interaction across multiple contexts. These difficulties include social emotional reciprocity, nonverbal communicative behaviors used for social interaction, and difficulties developing and maintaining relationships appropriate to their developmental level beyond those with their caregivers. That's a lot of technical language, so let's explore each item separately. The first term has to do with social emotional reciprocity, which is the back and forth exchange of social communication. Individuals with autism can have an abnormal social approach and response to interactions. That can look like reduced sharing of interest, emotions, and affect, or a failure to initiate or respond to social interaction. Deficits in this skill can look different depending on the age and developmental level of the child. Let's look at these two pictures. In the first picture, this young child is pointing to show someone something that he is interested in. He is trying to get the other person's attention to the trees by pointing to the trees and looking at the person whose attention he is trying to grab. That's a great example of social reciprocity, sometimes called joint attention. The second picture shows an example of parallel play. Parallel play is a form of play in which children play adjacent to each other, but do not try to influence one another's behavior. Children usually play alone during parallel play. However, as children get older, they eventually begin interacting with one another in a back and forth manner to play with each other. Children with ASD may continue to play independently or in a parallel fashion, rather than developing this back and forth play. For older children, a lack of reciprocity might look like a lack of back and forth in a conversation. The child might start a conversation about a topic he's interested in and continue talking about that topic in depth and in great detail without including the other person in the conversation. For example, the character One Sided Sid might go off on a long tangent about trains or Minecraft and not include his friend in the conversation, not leaving him room for his friend to respond or to ask questions or even change the subject. Next, let's talk about the term nonverbal communicative behaviors used for social interaction. This can look like poor coordination between verbal and nonverbal communication, such as talking while facing away from the intended listener. It can also include abnormal eye contact and body language, or the difficulty in understanding and using gestures. For some individuals with ASD, it can manifest as a total lack of facial expressions and nonverbal communication. Let's look at some real people examples. The first picture is of a boy showing 12 different facial expressions. How do you think he's feeling in the top left picture? You have made a guess about how the boy is feeling based off of his facial expression. This task can be very challenging for a child with autism. Children with ASD have both a difficult time understanding the nuances of facial expressions in others, as well as changing their own facial expressions to match their emotions. How many of you use your hands to talk? You likely use your hands while talking to place an emphasis on what you're saying, like with an emphatic gesture, or to describe something you're talking about. Understanding the gestures of others, as well as using gestures to communicate, is something that can be challenging for children with autism. Children with autism may also have a hard time looking someone in the eye or providing eye contact while speaking. The image on the right side of the screen is of a visual prompt that is sometimes used to teach children with autism the routine of providing eye contact to the people they are talking to. Finally, developing and maintaining relationships. This can look like difficulties in adjusting behavior to suit different social contexts, difficulties in sharing imaginative play, difficulties making friends, or even an apparent absence of interest in people. What does this look like in real life? The image on the top left-hand side of the screen shows a picture of three young girls pretending they're having a tea party. This is called imaginative play. The image on the lower left-hand side of the screen shows a picture of a young boy lining up his cars. His play may be very entertaining to him personally, but he is not using creativity to play with his toy cars. It might be very hard for him to join in with another child who wants to play with cars. Another boy his age might want to play with the cars more creatively by racing them around the living room, and he may not be able to do that. The image on the right-hand side of the screen is on the unwritten rules of social relationships. When we talk to our friends, we speak in one tone of voice, use certain words, and talk about certain topics. When we talk to our bosses, we use other tones of voices, other words, and talk about other topics. We change our behavior based on the place we are in. How did we learn how to do this? Did anyone ever sit you down and tell you to act differently in front of your boss than your favorite coworker? You probably learned through experiences that taught you how to act at work and how to act when you are with your friends. These are unwritten rules, and they can be very hard for an individual with ASD to understand. Let's leave social communication difficulties behind and talk about the next category of autism symptoms: restricted, repetitive patterns of behavior, interest, and activities. That's quite a tongue twister. The DSM 5 states that for the diagnosis of autism, at least two of the following must be present: stereotyped or repetitive speech, motor movements or use of objects, excessive adherence to routines, ritual patterns of verbal or nonverbal behavior, or excessive resistance to change, highly restricted, fixated interests that are abnormal in intensity or focus, and hyper or hypoactivity to sensory input or unusual interest in sensory aspects of the environment. Let's look at each one of these items separately. So, the first criteria of stereotyped or repetitive speech, motor mannerisms, or the use of objects can look like different things. Repetitive motor movements can include hand flapping, finger movements, posturing, spinning, and head banging. Repetitive speech can include echolalia, which is the immediate repetition of someone else's speech, as demonstrated here in the picture, as well as scripting, which is the more delayed repetition of speech, commonly lines from a movie or from a TV show. For the next symptom, insistence on sameness or resistance to change, it can look like different things. This includes extreme distress at small changes, like moving around a set of toys that are specifically organized by color or by size, difficulty with transitions, rigid thinking patterns, greeting rituals, or the need to take the same route or eat the same food every day. Children with ASD can have tantrums if the plan for the day changes. They can have trouble adjusting to a new babysitter or a substitute teacher, and they can have very black and white thinking about particular topics. Next, there's a symptom of highly restricted, fixated interests that are abnormal in intensity or focus. This can include a strong attachment to or a preoccupation with unusual objects or parts of objects. It can also include excessively circumscribed or perseverative interests. So, what does that mean? Well, we all have topics or subjects that we are very interested in. Some people love football, others love to read about politics, and some people collect coins. However, people without ASD are all able to move flexibly from their preferred topic to a non preferred topic or an activity with minimal distress. They're able to watch football and then turn off the football game with little frustration to move on to the next activity. Individuals with a diagnosis of ASD can have a very hard time transitioning from thinking about their most favorite preferred topic to another topic or area of interest. They often become restricted in their interests. Finally, there's hypoactivity to sensory input or unusual interest in sensory aspects of the environment. Another mouthful. This can look like apparent indifference to pain or heat or cold, adverse responses to specific sounds or textures, excessive smelling or touching of objects, or fascination with lights or spinning objects. There are a lot of different sensory experiences in the world. We see with our eyes, hear with our ears, touch with our hands and skin, smell with our noses, and taste with our mouths. For a child with ASD, these experiences might feel very intense if they are hypersensitive to sensory experiences, or very dull if they are hyposensitive to sensory experiences. Remember the video we watched earlier? The child in the video showed what it feels like to walk down a very busy street. While you and I might tune out the sounds of traffic, the bright sun, or the smells around us, this can be very challenging for a child who is hypersensitive to sound, lights, and smell. These difficulties can cause a child with ASD to avoid certain foods, certain places, or even certain people because of the sensory experiences associated with those foods, places, or people. Moving on from the diagnostic criteria of ASD, many individuals with ASD are more likely to have a variety of medical conditions, including epilepsy or seizures, gastrointestinal problems like constipation or diarrhea, feeding difficulties, and sleep disturbances. In addition, they are more likely to have psychiatric diagnoses like attention deficit hyperactivity disorder, anxiety, depression, and obsessive compulsive disorder. These conditions can be screened for and treated by other doctors or subspecialists as part of the child's treatment team. So, what are the things that parents should know about the next steps? Well, it's important to reflect and center yourself around some of these key points. Firstly, parenting is challenging, but parenting a child with ASD requires resilience. Attending or watching an autism parent education program like this one is a great way to start. Parents must learn to be an observer of behavior because that may be how their child really communicates. They should learn to set priorities, develop a support system, and become better educated. They should decide what works and what doesn't, and then try something new, recognizing that there is no one right intervention. Speaking of intervention, there are many kinds of therapies that may be helpful for an individual with ASD. Each child with ASD is an individual, and intervention should be tailored to fit that child. Evidence based practice is our recommendation. We recommend interventions that have the support of research, have a sound theory behind them, and demonstrate a direct relationship with success and improvement. Here's a list of some evidence based therapies. Applied behavioral analysis or ABA therapy can be accessed through your insurance provider and is the most commonly prescribed therapy for autism. Your insurance company may require you to obtain a referral from your care provider, so it is always best to first consult with them before moving forward in pursuing ABA services. The Early Start Denver model, or ESDM, and floor time are interventions for young children. ESDM is based on ABA and uses play to help build a positive relationship with the child. Similarly, floor time is a relationship based therapy for children with autism that helps children build their communication skills. Relationship Developmental Intervention, or RDI, trains parents to become the primary therapist with a focus on emotional referencing, social coordination, language, flexible thinking, problem solving, and developing insight into experiences. Speech therapy can help children with ASD develop the social communication strategies explained earlier, such as eye contact and back and forth conversations, as well as support their development of age appropriate speech. Occupational therapy helps children continue to improve their everyday skills that allow people to become independent and participate in daily activities. This is just a sample of various therapies that are sometimes used in children with autism. There are many more out there that you may discuss with your healthcare provider team. How do you get these therapies? Well, most families will access these therapies through their insurance, which does require several steps. Parents should work with their care provider to identify which referrals are right for their child and for their family. Then you should work with your insurance company to obtain referrals. Don't be afraid to reach out and ask questions of your care team if you need help. Unfortunately, there is no medical cure for the core symptoms of ASD at this time. Medications can be helpful to decrease the symptoms associated with a diagnosis of ASD, but does not eliminate these symptoms. All medication intervention should be proposed to help support an existing plan of intervention rather than being used by themselves. Appropriateness of a medication treatment are based on a risk versus benefit ratio, as all medicines have side effects. Discussing the different kinds of behavioral medications that are prescribed for individuals with ASD is beyond the scope of what we can discuss here, so I would encourage parents with questions about medications to reach out to their medical team. Many children with ASD may also experience challenges accessing curriculum in the school setting. If your child is having difficulty accessing the curriculum, you can request an assessment for an individualized education program from your school district. IEPs are based on areas of need that are determined from the assessment completed by the school district. Some children with ASD are able to access their educational curriculum even though they have this medical diagnosis of ASD. In those cases, children can be offered support through the school in the form of a 504 plan. 504 plans provide accommodations to children in school, such as preferential seating, extended time on tasks, and adjusted schedules, among others. If you have more questions about the support your child may need in school, the Center for Autism at UCI also hosts classes on special education law that could explore this topic in more detail. Finally, in California, individuals with ASD may qualify for additional supports through the Regional Center. The Regional Center is unique to California. It has two separate kinds of programs that can service this population. The most commonly utilized arm of their services are Early Start services, which covers children 0 to 3 years of age. To qualify for early start, children must be at high risk for developmental delay or show at least 33% delay in cognition, communication, social emotional skills, adaptive skills, or motor skills. Some older children will continue to receive support through the regional center by qualifying for Lanterman services. To qualify for this service, the individual must have ASD or another qualifying diagnosis, as well as substantial impairment in 3 or more areas, including self care, language, learning, mobility, self direction, capacity for independent living, and economic self sufficiency. For more information about Regional Center services, I encourage you to contact your local Regional Center office. If you're feeling overwhelmed, know that you're not the only one, and know that there are other resources out there to help you. Autism Speaks has a large number of toolkits that can help, and how I would highly encourage looking into their resources because they explore a lot of common areas of concern for children with ASD. Another good website is Swanky Brain. That website has lots of social stories that can help you explain certain social skills and experiences to your child. It's also important to take care of yourself. Sometimes that means joining a support group to be surrounded by others who can offer you additional resources. Here is a list of some other excellent organizations that are available in Orange County. That concludes this Autism 101 talk. I thank you very much for your attention. If you have additional questions or would like to know about additional classes, please feel free to reach out to the contact information displayed on this slide or find us on Facebook. Thank you very much.